Hi everyone, this is Beth from ENAGAGE, the European Network of Gynaecological Cancer Advocacy Groups, and it is Endometrial Cancer Awareness Month, Uterine Cancer Awareness Month it's also called. And today we have a guest, Bar Levy, and so we are going to invite her on the call and talk about endometrial cancer and her work. And we will get her on the call. Hi, Europadana. Hi, Bar.
We did it.
That was so easy. I love it.
Yeah.
Nice to see you. So
nice to see you too.
Thank you for joining us. We already have some people who are coming on and saying hello, waving at us. And so this is Bar Levy. Bar is a patient advocate. She's the founder of Habayit Shel Bar in Tel Aviv, Israel. And she has had a bunch of visibility into how to do policy for endometrial cancer, to benefit endometrial cancer patients, and to talk about awareness in a local and regional and maybe global aspect. So Bar, could you tell us a bit about yourself and how you founded Habayit Shel Bar?
Hi everyone, thank you so much for inviting me for this live. Actually, it's my first live, so I'm very excited. Thank you for that. My name is Bar, as you all know. I'm from Tel Aviv, Israel. I founded Habayit Shel Bar, the Israeli Women's Cancer Association, 4.5 years ago, almost 5 years ago, after I lost my mother to endometrial cancer. My mother was diagnosed mid-corona time, COVID-19 time. She was suffering from abnormal vaginal bleeding for, I think, almost 2 years. And we had no idea, we had no idea that it could be a symptom until she was very, very sick. And it was it was very hard to miss it. And then it took 9 months of treatments and surgeries until she passed away. But when she passed away, we had a shared dream of founding an association for endometrial cancer patients and gynae cancer patients in Israel. And I just felt like it was her unwritten will to do so. So this is how I got to do it.
So it's taking her legacy and putting it forward for other people.
Yes.
Wow. And I mean, you have done some amazing things in a very short amount of time. You joined ENAGAGE. Again, this channel is for ENAGAGE, so I have to say ENAGAGE a lot. You joined ENAGAGE at the Berlin meeting in 2022, I think.
Correct.
Right? And
yes.
Since then, you've already spoken at not only national but international congresses and also at the European level, right? Last week you were in Brussels, is that
yes,
right?
But I did not speak that. I just witnessed some amazing people speaking. But I had the privilege to speak in several ESGO congresses, including the Rome one, and it was very fun.
Yeah. So in the Rome Congress, you were on a panel. You were you were the patient advocate, the patient's voice, on the panel about the new ESGO Estro ESP endometrial cancer guidelines update. Could you tell us something about that project?
So first of all, it was an amazing experience. It took a few years to update those guidelines. So the process started 2023 and it was published in the Lancet last year. So the process was very long but very fun. First of all, on my personal perspective, I took the liberty to learn everything. So I got myself very educated about endometrial cancer pathology, treatments, radiotherapy, epidemiology, of course, and to try to understand how the clinic is meeting the patients and the patient's needs all together. So when we read the literature, it's not trying to understand how to treat the next patient, but trying to understand how it meets the next patient and how we can change the landscape or adjust it in order for the treatment to work in the best way. So, for example, in the new guidelines, the new staging was introduced, and the new classification for the risk classification, sorry, for the recurrence of disease. So, for example, it was influencing us in a way that we needed to be able to adjust the policy so it will meet the new guidelines, so it will be easier for the countries to introduce new drugs, new technologies for their patients. And there was a very interesting question at the room on how low and middle income countries will understand this new risk classification when not all countries are actually having the right technology to make the modifications that are needed for that. So it was
Right.
a very
And so
interesting.
if in case someone's watching this and they're not familiar with the backstory on this, so the endometrial, all doctors ideally agree on when a patient has this certain stage of a disease. These guidelines help to explain to other doctors so that all doctors are working from the same playing level and all patients can then get the same level of care, right? But anytime they do an update, there are questions how to do that, right? And as you said, especially now, since technology is so much a part of it, there are questions about whether low-income countries or lower resource countries, maybe not income, but maybe even rural areas in high-income countries can manage to do this correctly so that all patients have the same fair treatment.
That's accurate, yeah.
So that's really a special experience. And how does it work? Like, is it very accessible to go into that kind of conversation to bring the patient's voice into the guidelines? I mean, as you are not a medical professional, right?
Yeah, I'm not a medical professional. I learned a lot during my lifetime, also in epidemiology and public health, but I'm not a medical professional. And it's different. Our perspective is different. It comes from the patient's perspective, from the caregiver perspective. And I think it's a discipline that is evolving today a lot, how patient advocates are actually contributing to a medical conversation or a clinical conversation. So it happens not only with a clinical setting of guidelines working group, but also with the clinical trials project of ESGO, ENGOT, and ENAGAGE. It's a question that we are asking ourselves all the time, how we can contribute to the clinical trials of tomorrow.
Yeah, and could you tell us something about that group? Because that's a very interesting project you're in.
Yeah, so this is an amazing group of many patient advocates from all over Europe. We had few learning experiences in order to make us patient experts in clinical trials and in some diseases that we represent. So, for example, because of my personal story, I find myself having more and more experience with endometrial cancer consultation, but there are some other patient advocates that are dedicated for some other diseases. And with that, with all the experience and the knowledge that we are learning, thanks to ENAGAGE and ENGOT, we are trying to develop a new modality on how we consult to the clinical trials of tomorrow. So the clinical trial of tomorrow will be more patient-centric and more patient-facing in order for it to be better in recruiting and with better outcomes and actually with better, of course, perception of the clinical trial itself. So if something is having a better outcome than the standard of care, then how we introduce the new drug for the patients in the home country. So this is also a question that we can address right at the early stage of designing a clinical trial when we model the endpoints and the design and the clinical trial designing.
Right, and that is something that I was really surprised to find out when I started working with ENAGAGE, is that patients in the past weren't involved in these kind of discussions. So it's really great that that's something that is now starting to happen, is particularly with these cancers, which are so, where the treatment is so life-changing, really, right?
Indeed.
Mhm. So I think that's a good point to kind of segue into talking about endometrial cancer policy in Israel, because you said that recently you managed to get some of that policy changed, right?
So I'm happy to say, very proud to say that the landscape has changed in Israel for the last 5 years for endometrial cancer patients. So 5 years ago, the new drugs and technologies were not reimbursed by the state. It wasn't accessible for the patients unless a patient had a private insurance policy, so they could access the drug, but most of the patients do not have those reimbursement settings. So we witnessed a lot of inequity and inequality within the Israeli society. So together with the clinicians and the Israeli Society of Gynecology Oncology, and of course the patients themselves, who contributed a lot from their experience and their knowledge, and came with me, to the Israeli Parliament and to speak with members of the Knesset. The Knesset is the Israeli Parliament, and to speak with the press. So we managed to introduce all new drugs and technologies for the Israeli patients, endometrial cancer patients, and we are very, very proud of it. So right now in Israel, if you're a patient, we hope that you're not, but you have every way to be able to get better and to be cured and to survive as long as possible. So the landscape has changed dramatically.
That's right, because I mean, I think some countries where it might be that this has always been covered, and so they don't think about this. But I mean, the financial burden of having to self-pay for cancer treatments when you're already going through a diagnosis is just another form of toxicity. I think the ESGO president had a thing about financial toxicity on our social media recently.
Yeah,
Yeah.
it's right. Yeah.
It's very another impact to life on top of the cancer treatment.
Indeed.
And so, apart from that, what is the situation for gynecological cancer and endometrial cancer in terms of awareness in Israel? Do you think that most people know what endometrial cancer is, or I don't know if you have we have the situation in English where endometrial cancer and uterine cancer and womb cancer, it's 3 words, but it all means the same thing, basically. But people still don't know about it, whatever name it is.
Yeah.
So what's the situation in Israel?
So thank God we have only one word for endometrial cancer.
Okay.
It's like endometrial cancer. So it's very easy to communicate on that level. I must say that 3 years ago, we were having a survey among healthy Israeli women, trying to assess the level of awareness to risk factors and symptoms. And actually, we saw that not a lot of women are aware. And it was very, very, very unfortunate to see it, that such an easy symptom like abnormal vaginal bleeding, most of the women are not aware of it. So we're speaking about 3 out of 4 women do not understand or don't know that abnormal vaginal bleeding, especially in menopause, could be a symptom of endometrial cancer.
Wow.
So yes, it's devastating, I must say. It also affected my mother. My mother was unaware. I was unaware.
Wow.
And you already know my personal story. So we are trying to change that. We are trying to change that in 2 ways. The first way is together with the clinicians. So we are talking with a lot of OBGYN doctors in the community, treating healthy patients, trying to shift the narrative a little bit more towards preventative medicine and health education and health literacy. So more doctors will speak more about how to modify one's risk factor and how to be aware of symptoms of diseases like endometrial cancer that one could be diagnosed with. The other way that we are trying to change that is, of course, with awareness campaigns to the general public, to women in general. And each year we have a very big campaign with one message, and the message is, if you have an abnormal vaginal bleeding, just go check yourself. As simple as that. We're investing a lot in media and in a creative way of raising awareness, and we try to publish patient stories online and with the press. So the woman tomorrow that will read the article or will see our video on Instagram will stop for a moment, think about herself. Did she go to the OBGYN for in the last year to get checked or something? And if she's suffering from any symptom, then God forbid, go check herself.
Right, right. Because I mean, I think that cervical cancer gets a lot of attention, I think, among the general public, because when you go to the checkups with your doctor that are requested, then that they're checking for HPV, for cervical cancer. But endometrial cancer, if you don't know that it's there and you don't know to ask the doctor, and the doctor doesn't say anything to you, well, then you think you're fine for another year or whatever. But
Exactly.
actually, people need to know their risk. They need to know the symptoms, and they need to know when they have high risk and symptoms that they should go and ask about something. And I mean, in addition um, to bleeding, I think one of the other risk factors that we have to mention is that there is a link to adipose tissue, which is also known as body fat. But fat phobia is such a problem with,
Indeed.
I think, for women around the world, from what I'm hearing, about going to the doctor for things even not related to gynecological health, that it can be a real hard question to talk about, right? Is that something
I
that you
agree.
experienced too in Israel?
Yeah, so actually, myself, I'm a little bit obese and I suffered from fat phobia during my lifetime. I think the last time I suffered from fat phobia was 2 months ago. It was
2 months?
yes, it was very inappropriate, and I think because I'm so used to it and I'm so strong, then I know how to just dismiss those thoughts from my head. But if someone is not used to think about it, or what are the risks, or to handle even with the healthcare system, sorry, then it can be so shocking that one can actually refrain from going to the doctor or to any checkups
Mm-hmm.
or to any screening check that can save their lives. And actually, there is a very big study in Israel done by Professor Diane Levine. She was investigating the barriers that fat phobia is causing from going to the doctor for annual checkups and to screen themselves. So we know it's a big barrier, but I think the problem is that we don't know how to speak about
Mm-hmm.
obesity and how to speak with obese patients. And part of it, I think, is because every doctor might think that they have to address that, but sometimes we don't want, as patients, to be addressed by the doctor or to our condition with regards to our weight. Maybe we came for something completely different and we do not want to speak about
Mm-hmm.
that. But a doctor can refrain speaking about it, but can show some respect to the situation and explain, this is the way you love yourself. It's okay. I respect you. Just know that you are at risk for this and that. And to look at obesity as something like, for example, smoking. If someone
Mm-hmm.
is choosing to smoke, I hope everybody knows that if you're smoking, then you are at risk for lung cancer. And if you
Mm-hmm.
feel any cough or something like that, then you will go check yourself. But this is not the situation right now with obesity, and I hope the conversation will be normalized in
Mm-hmm.
the near future.
Right. And also in a way that doesn't make people feel bad about themselves, or that they are, at fault. Nobody is at fault for anything, but your body has some unwritten codes inside of it, or written codes inside of it, that might trigger something that you need to know about it, or those
Exactly,
symptoms. I mean,
exactly.
our campaign this year is about taking care of yourself, like that, knowing these symptoms and knowing your risk factors and making a check with your doctor and making an appointment to talk to your doctor about these risk factors is actually taking care of yourself. And talking about it with other people is taking care of your friends and taking care of your community. So,
Exactly.
I mean, these things, it's interesting that they are such a universal phenomena, but it's also sad that, like, can't we have one country where these things don't happen? So, Bar, this has been such a great conversation. Thank you so much for
Thank you.
talking with us today. Could you kind of give us a final thought about, what would you say to someone who is maybe worried that they are experiencing a symptom of endometrial cancer?
So first of all, if you're worried that you're experiencing any symptom, then just go check yourself. Go to the GP if the OBGYN is not available, or go to the OBGYN if it is available in your healthcare system. It is so easy just to speak about your feelings. And if you feel like you're dismissed, because we know that women are experiencing that as well, then just go to another doctor and understand what your body goes through until you get all the answers. And to my fellow patient advocates, I say that we are very fortunate to live in an era that the landscape of endometrial cancer have changed dramatically. And today our patients can enjoy so many possibilities. If anyone needs help with any policy matter issue or raising awareness or anything other, then I'm happily will help, and hoping that every endometrial cancer patient all over the world will enjoy all the good that we have today to offer.
Yes, I hope that everybody who finds this video can take something away from it. Thank you so much, Bar.
Thank you. Thank you.
It's been very nice. And everyone, I wanted to mention I'm wearing a peach colored shirt today. So
Almost.
peach is the color of endometrial cancer. It's the closest I could get. Peach is the color of endometrial cancer. So if you want to raise awareness, put on something peach and challenge your friends to do the same. All right. Have a great afternoon. Thank you so much.
You too. Goodbye.
Bye.
Bye bye.